Question number 1. I have lupus and want to have a baby. Is it safe for me to get pregnant? Lupus and pregnancy can be challenging, but with planning, it's definitely possible to have a safe and healthy pregnancy with lupus. The most important things with lupus is that we strongly recommend that before you become pregnant that you have not had a flare within the past 6 months. That also means that you should be on medications that you can continue during pregnancy, especially if your medications have prevented the flare for the past 6 months. The studies show that if you have not had a flare within the past 6 months prior to becoming pregnant, it dramatically reduces the likelihood of adverse events for both mom and for baby. Some of the things that can sometimes happen during pregnancy are certainly flares can occur more frequently. The baby can be of low birth weight or even worst case scenario, a stillbirth, and it's much less likely for these things to occur if you've been stable for at least 6 months prior to becoming pregnant. The most important thing that I recommend you do is have a conversation with your rheumatologist about your desires for having a child. As I mentioned, it's important that you haven't had a flare for the past 6 months, especially while taking medications that you can continue during pregnancy. So if you're on certain medications that you cannot continue during pregnancy, sometimes those will have to be switched, which may take some time if we want to do it safely. The other really important thing is to recognize that with lupus, whether or not your lupus is really well controlled or really difficult to control, if you have lupus, you automatically are considered a high-risk pregnancy, which just means that you need to be followed by an obstetrician gynecologist who specializes and is comfortable with treating pregnant women who have complex medical conditions such as lupus. That's really helpful because sometimes there are symptoms of lupus like fatigue and swelling in the legs, and there are symptoms of pregnancy like fatigue and swelling in the legs that can be difficult to distinguish between one another. And if you're followed by a specialist who's comfortable with managing lupus, especially in pregnant patients, you're more likely to catch symptoms early and treat them as appropriate if necessary.